is it's time for Americans to be responsible. Unfortunately, it's been a little too easy to be ignorant and reliant. And I think that's really America's, the country, I believe, if we're going to regain our footing, sort of like this keel of a sailboat, the constitutional principles by which we're have created a wonderful society and nation, it's time for us to be informed and responsible. And that's really what the Tea Party, I think, if there's a theme that all the Tea Parties, there's way many. So with that, I'm going to get into my talk tonight, and bear with me here. Let's turn on this device. There we are. Okay. I actually began this talk, or gave a version of this talk a year ago almost at the Lincoln dinner, and American Healthcare, Hope or Change. Well, that's a little play on Obama's campaign words, of course. But I'm really here to tell you that I'm not a great political theorist or an academic that studies Medicare budgets and analyzes great American demographics, although I'm in the middle of Medicare and medicine and healthcare in every day of my life for the last, since 1971. I see healthcare this way, looking into a patient's eyes. This is whenever you're going to give an address, my wife, who is a nurse, even though she's retired, she's always a nurse. You don't really ever leave being a nurse. She said, make it personal. And this was a patient I happened to be operating on last March. Now, this young man of 87 years, when I met him, needed this device right here. It's called an aortic heart valve. Without this, he could not live, would not live to Christmas and see his great-grandchildren or spend more time. He was in congestive heart failure. So there was only one way, one thing that could possibly be done. There were no medicines, there were no magic devices, there were no CAT scans. This mechanical valve, or a valve like this, had to be placed inside his aorta after removing his heavily calcified and diseased aorta. That's it. That was the challenge that we and our team faced for one patient one day. And I've often said, when I came to town here, we were trying to reestablish cardiac surgery, but we can do it one family at a time, because I'm a piecemeal person. I do one case, I operate, I take care of the patient for the next several days, but it's one at a time. Well, here's a young man. He's 87 years old. He was a D-Day combat medic. When I heard that, I went over to my office, grabbed my 101st Airborne hat, put it on his head, and took this picture. Wonderful guy. He was 19. He said, Doc, I was so scared. As soon as I got down there, I'd lost my weapons. I ran over, found a dead soldier, stripped his M1 up, cleaned it up. He was a medic, which is illegal under Geneva Conventions, by the way. He grabbed his M1, which is considered an aggressive weapon. Even then, they used to call them assault rifles. Medics, because they have a Red Cross, aren't supposed to carry it. They have a .45. He said, I blew out those Geneva Conventions so much watching people get shot. He said, I carried that M1 for the rest of my time in Normandy. Wonderful guy. I see healthcare as a promise that we keep to people. It's about being there when they need us. And in his case, he's also a veteran and a Medicare recipient. So he really represents a lot of what we in the healthcare world really need to keep a promise. He's 87 years old. He needs this valve. It's going to cost some money. Oops, the money's down there at the bottom. It says $30,000. That's about the expense of the hospitalization, all the team of 8 people in the operating room, the hospital, the cost of this, the manufacture of this device. This is worth about $4,000. We have to have a shelf full of them for every size in each valve site, your mitral valve, your aortic valve. So the hospital has to have inventory of valves, just like a shoe store. It takes a consumption of national wealth to produce what this man needs. And $30,000 is a pretty good hunk of money, I thought, or I still do, till I figured out, I got a hold of the U.S. Air Force site and found out what it cost to fly Air Force One for 1 hour. It's $188,000 per hour. That's fuel, security, depreciation, maintenance, you name it. $180,000 per hour. That's just for the Air Force One. There's also a piggyback plane that flies in trail. If you can get on the History Channel and see all that. The point is that this world's simplest trip by a single man, the president, costs an enormous amount of money. So I didn't feel so bad spending the money on old Ed there, because he deserved it. And it comes out to 11 minutes of flying that plane. That's it for a man's future with his grandchildren. What I'm trying to make with that point is that there's an obligation by we in the healthcare fields that we've gone to the trouble to acquire this knowledge and gift. We have people that are deserving and which he has been returned to a normal life and life expectancy. And we're in a nation of great resources. Our real problem is not that medicine may be expensive, but it's a question, how do we choose to use our resources and with whom and how? And that's really the challenge on healthcare. We have enormous resources in this country. Are we spending them wisely and well? And I'll submit that, in fact, I know this man and his wife, and he's worth any 11 minutes of flight time any day, any time in my book. And he's done well since then, hasn't spent a day in the hospital. But healthcare I see through the eyes of one patient at a time. So that I come in with those biases. What's best for my patients? So here's our choice as a nation. We can be ignorant and thus reliant, or informed and thus responsible. And I choose the latter, and I hope tonight's part of that journey. Okay, I'm going to give you a tool because to understand where we are in healthcare, and particularly the government, this is the Doug McConnell simple tool of how to understand really big numbers. You may have seen something like this recently on TV. Another surgeon, neurosurgeon, Ben Carson, and I suggest you all get to know his name very quickly. He had his analogy. I've used this one. I used this last year. But even astronomers know that we cannot calculate big numbers in our heads. That we don't have an emotional feeling for them. They get million, billion, trillions. It doesn't mean anything. So astronomers turned long distances into time, light years. When someone says it takes a year for the light to travel the distance between two stars, that's big. When they say 3,000 light years away, you say that's really big. That's time. And we understand time. We're built in with time. We only live so long. So convert dollars to seconds, and let's go on this little journey. 1 million seconds is 12 days of time. Everybody with me on that? 1 billion seconds is 32 years. What's 1 billion? And 1 trillion seconds is 32,000 years of time. 1 trillion. The national debt is 16 trillion and climbing, so that's 512,000 years of time if you had $1 for every second. These are really big numbers. They're not Democrat numbers, Republican numbers. They're just math. And when someone talks about paying interest on huge numbers, you now understand 16 trillion, even if it's a 3% interest rate or a 10% rate. Those are really big numbers. So this is a tool that you're going to need to file away and use in the coming years. Remember, informed and responsible. This is a tool. Because 16 trillion is one heck of a big number. When your president, basically in an interview, says we don't have a debt problem, we can manage it right on up to $1 trillion, you're actually listening to someone who doesn't know this, doesn't appreciate it, or who basically chooses to be ill and uninformed. Also, the national debt has always been expressed as a percent of our income or as of our society. And this is just a plot, comes right out of the Office of Management Budget. That's a governmental office. That's just a line that tells you exactly what's going on. Remember, I'm a surgeon. I have to live by, when I'm in the operating room and I'm operating on someone's hearts, I have to live in the world of physics, biology, anatomy, physiology. There are rules. I can't just wing it or make it up. I have to basically obey the basic biological principles of what it takes to stop a heart, to start a heart, to go inside, put the stitches, where to put them, how to anchor them. You can't wing it. This isn't about being a politician and just making things up and promises that you can't keep. When I look into a patient's eyes, I've got to keep the promise I make. I also have to tell them the truth because that's who I am as a person, but also I could be sued if I misled them and lied to a patient. But my ethics as a physician, as a surgeon, don't let me lie or mislead a patient ever. That's a little different than some other worlds. But this point is these numbers are very real, and they're just like the anatomy and physiology I have. Just like Ben Carson's a neurosurgeon. He can't make stuff up in his day-to-day life and make his reputation. You can't do it by magic. You have to perform. All right, so here we are. This says our time's up here. You have an elephant and a donkey, two parties looking over the cliff saying, well, whew, thank goodness we averted the fiscal cliff. They're really happy. What they're not doing, these things, debt, entitlements, and Obamacare, are enormous numbers cascading down. This is going to affect all of our lives, and this is not, again, a partisan picture. Okay, here's my opinion. Obamacare will fail spectacularly. because of complexity, confusion, cost, and coercion of providers, people who actually have to do the work. This is actually potentially a great opportunity for the Republican Party and the conservatives of America to make the stand about why this will fail. Because when the wheels come off this, and I think they will rather quickly, you notice how it was all set up to basically take place after the election, Obama's second election. That's because when this all falls apart, the question will be what fills its void. Now that maybe sounds radical to you, but I think it's something to think about, because I believe that there are people within the Democratic Party that when it falls apart, they have a solution already. They've always wanted to jump to called the single provider. Do you remember all that talk? And politically, they couldn't, the American people never do it. So really, I think this is designed, and I'm going to show you some expert people that actually see that this is really designed to fail, and I'll get to that in a minute. But bear with me as I go through this. I'm going to show you some of the examples of why I think this will ultimately fail. This also brings up Ronald Reagan's great statement years ago in his inauguration, government is not the solution to our problem, but government is the problem. And that's definitely true in healthcare as a practitioner. And remember that this bill is actually not called Obamacare, it is in the press. And again, I apologize for my Robert and I were going to change some of these, but I didn't get to do it. But he warned me this might happen, so he knew and I didn't. It's really called the Patient Protection and Affordable Care Act. God, that sounds wonderful. So just loving and arms wrapped around it. Well, the road to hell is paved with good intentions. Do you remember affordable housing? Okay, that was a government program. And we're living through the financial hell created by that. They're trying to push it all off on Wall Street. But in truth, if you really get down to the facts and find out this has to do with the government changing the business structures. Well, we're really now in the era of affordable health care. They tried affordable housing. How'd that work out? Affordable health care is what we're on the cusp of at the moment. Affordable housing, it was a boom and then a bust. Everybody, how many in this room heard the radio ads, no proof of income required to get a loan or refi, right? That very second, every one of us should have recognized something is really rotten in Denmark. Because that meant, and this is Thomas Sowell, who is a great individual to read, economist at Stanford University. Political goals subverted business common sense through regulation and intimidation by the government for political purposes, period. And that changed the entire mortgage industry in this company. It did create, by dumping money into an industry, a period of boom with houses rising, people flipping houses. You guys, everybody here who was a homeowner felt good as they watched their house value go up and up and up. My wife and I saw our neighborhood in Long Beach, said, who could afford to buy these houses except drug dealers? I mean, the prices were crazy. But then the bus comes, and we know how that's worked out through our society. The point is, they co-opted a common business sense in the mortgage industry for a political series of purposes that they hit and run and left. Here's coming affordable health care. We shouldn't have to go through something like this twice. Just think about this. How can government possibly make quality health care appear affordable? What tools do they have? Except to subsidize it, meaning take money from one place and put it over here, funny money, printed money. That's one tool. Government can regulate things and regulate the price of it, price fix. They've done that before. They can have the power of tax. They can ration it, meaning don't let people use too much of this or that, and coerce or enslave the providers. That's technically illegal, but depends upon what coercion is. If you have pushed up the cost of 4 years of medical school education and 8 years of residency to where you have enormous debts upon graduation, which would be partially written off if you're willing to work here or there for 8 years at this reduced income rate. There's all sorts of subtle coercion that's financially available. But how do these powers provide quality care? They cannot. There's nothing about the government that can ensure quality care. They can enter the financial marketplace and try to fiddle with insurance rates or lean on the providers or regulate insurance policies or put crooks in jail who are insurers that are abusing the system, perhaps. But they really don't have much power except to nationalize an industry or basically draft everybody into the military and make them give pay or whatever. But the government itself, remember Reagan's quote, is a cost driver. They create governments, and I'm talking city, county, state, and federal. They can create mandates that are politically driven. They want to cover all the needs of autism in New York. Worthy co-ops, but does it belong in all insurance policies? Second and third opinions on breast cancers for women. Again, worthy, but why do you make the insurance industry provide that cost coverage? That's true in New York. They can control the pricing. There's a reason we don't have 50 states, there's a reason we have 50 separate state healthcare lobbies. You don't have the option of USAA sitting in Texas, where I get my auto insurance from my military active duty days. They can't write healthcare in California. Every state has their own commission and regulator, and they control the local insurance staff because that's an opportunity to be bought off, traded off, politicize the goals. The politicians in California can decide to do gender switches and can make your employers cover that, which might not be politically popular in Indiana. The point is, if you had an open network of really across the country legitimate insurance policy environment, you would watch prices change rather dramatically, but the politicians actually tell you what's on the menu for the insurance companies. It's all dictated. Some states have 70 mandates, so that must be in the insurance policy for you to write it. If you go to prove this, go shopping yourself to ehealthinsurance.com, call yourself a 42-year-old or put your own age in there. So I put a 42-year-old single male, real simple, absolutely healthy guy, and basically he wants a pretty standard $4,000 to $5,000 a year catastrophically covered health insurance with fairly significant deductibles and an HSA policy so he can get some of his own income back. Well, in New York City, that policy costs you $8,000 a year because of what New York's put into that policy that a 42-year-old single male doesn't need, like doesn't need second and third opinions for breast cancer, in truth. And there's a variety of other things that they have in the city. But in Dayton, Ohio, and you just change your zip code, this is how you can do it yourself. You just pretend you're shopping and get the zip code of Dayton, Ohio, which is where I was born. Put that in, same policy, very close, private insurance program, $1,400. That's a five-fold difference for the same patient, 42-year-old healthy individual, that the marketplace is so skewed by politicians and government that the people in New York City, and believe me, are paying 5 times more than Dayton, Ohio. That's government at work. You need to understand Obamacare is a misnomer. Really, what we're sitting at today is a piece of legislation, but it's been 30 years or more in the making with the professionals in Washington in Health and Human Services. It's a natural bureaucracy that basically is convinced that they can just manipulate certain things within this huge marketplace called healthcare, which is 1/6 of the American economy, that they've got to be in charge of it. They just have to do it. Now, I don't think they're evil people necessarily, but they're just convinced that the bureaucracy and their own abilities are so good that they can manage this marketplace. Healthcare is a huge marketplace. Imagine if these people actually were able to take over the distribution of food in America and why they would necessarily want to change what's at the Safeway or at Raley's and how they would trigger all that. They could control it. Right now, nobody decides at any government level when Raley's and Safeway start to load up on Thanksgiving goods and order the cranberries and order the turkeys, do they? It all happens automatically, the wonderful marketplace in food, which is almost more important than healthcare. But this has been going on for 30 years. Both Democratic and Republican administrations have participated in this. It tends to grow really fast when Democrats are in office. Republicans still have the same professional bureaucracy. You may change the people at the top, but it grows. And it leads to this, where we are. The wonderful, absolutely truthful comment. We have to pass it to see what's in it. Now, I live in a world where I'm held to a very high standard of professional competence and honesty with my patients. I think there should be something called mal-legislation. I have malpractice to live with on a daily basis. If I dared to pick up a scalpel and open the chest on a person with whom I had not had a frank, honest, informed consent to teach them as to what we hope to accomplish with the operation and show them what we're going to do, showed them that valve I brought out here, I would be guilty of malpractice. I mean, I'd be sued for it. That's why I have rates cost me almost $40,000 a year in just insurance coverage against this huge industry, because I'm held to a very high standard of performance every case, every day. I don't know why we, the people, don't expect legislators to read what they're voting on. It would seem simple that you would expect them to have working knowledge of the bill before a vote is cast. That would be a little bit like expecting me to show up at the table with actually knowing which patient it is and what the planned operation is. It's a given, but not so. There you have the Speaker of the House admitting, what the hell, we didn't know what's going on here. So let's see what's in it, and here is the official organization chart of the Patient Protection and Healthcare Affordability Act. There you go. Now, in the center sits the Secretary of Health and Human Services. This is a congressional document that you have right here. It's called Your New Healthcare System. The doctors are down here, the patients are over here, Congress is up here, the IRS, oh, they're there too. President's up in that corner, and everybody's got a piece of the action. Every one of these lines is an information or dollar flow that's in here, and there's committees in here you don't even believe. IRS has 16,000 new agents funding in that bill. That's just to deal with the insurance issues and the mandates and trying to figure out what your household net income is to figure out how much the tax credits they're going to cut out and send off to an insurance company. You don't get the tax credits. The insurance companies do. I'll get to that in a minute. This economy, the American health economy, is $2.7 trillion a year. That is bigger than the entire economy of France. That's very important to understand. The American healthcare economy is bigger than France, bigger than France's military, their farms, their wines, their high-speed rails, their airports, you name it. That you're looking at a complex economy that's bigger than France that is going to be centrally managed by the Queen of France, in this case, Catherine Sebelius. And they actually believe that they can figure this all out and have control levels. This just reminds me of the control room in Star Trek, where there's Captain Kirk and everybody, and all. There's this big ship back there, but they sit in the room and say, "Hey, Scotty, you can make it warp speed 6," and he's yelling back from somewhere else. The point is, they actually see this as controllable. God help us if they ever thought they'd have to do that with food supply, because they'd come up with this sort of org chart. Anyway, there's about 160 new committees. There's a whole bunch of taxes in this. What you're looking at was so complex, but they managed to get the original bill down to under $800 billion of new spending for the first 10 years, starting in 2010. Actually, it was 7 years, excuse me. They didn't want to count all that. So they basically lopped off the last 3 years of spending and gave you a number to get it passed. You were lied to. The CBO was forced to score it at $800+ billion costs. That's because the CBO, Congressional Budget Office, must score a bill based on how it's presented. And if I wrote a piece of legislation and said Martians would land on Santa Monica Beach in year 4 of my spending and dump gold bullion on the beach, they'd have to score that. I'm being a little facetious, but the truth is, if it's in the bill and it's been voted on, or going to be voted on, that would have to be in the cash flow. Nancy Pelosi even had the nerve to say, we'll save $82 billion, she said. It'd be wonderful. And she said, we have to pass the bill so you can find out what is in it. But what they didn't tell you was that they knew, every member of Congress knew, that the only way that became $800 billion projected cost, new cost, was they were withholding $227 billion in make-up payments to the physicians. That's over a decade, so it's $22 billion a year. By the way, remember my seconds and billions, so these are big numbers. That was hidden from the American public. Every member of Congress knew that if they didn't adjust that and put money into it quickly, that this entire merry-go-round would come to an end on January 1st, 2010. And even before the bill was paid for. Remember, this was sort of voted on the end of 2011, excuse me. This was all voted on the end of 2010. They immediately had to do a very secret doc fix and found $27 billion of funny money or Chinese money or whatever, and pump that into pay to keep physicians' pay at the same level from the previous year, not an increase. We're talking about Medicare here. That's all we're talking about, $27 billion in Medicare. There was a cumulative cut coming down the track every year that Congress has put off, which was totaling $227 billion. And Congress kept acting like, well, some year we'll get around to actually cutting them. But the physician pay has only been going down year after year after year after year for Medicare, and I'll show you that in a minute. But the point is, they lied about this cost, and that was a lie to you as well. I was an Army officer, and I was with an all-volunteer 101st Airborne, and leadership there was based on trust, but not when you're lied to. In fact, we used to have a motto I learned from some senior NCOs: liars can't lead. So, but the 10-year cost today by the CBO, that's now 2013, looking ahead 10 years, isn't that little $800 billion. Oh, no. It's $2.5 trillion of new money that's going to be found somewhere. There's 159 commissions or boards in that arrangement, each one of them fully staffed and with offices and personnel. The new taxes total at least $836 billion by 2022. These are taxes we haven't talked about. These are taxes that are in the bill, not what just got laid out recently with the compromise. There already is a 2.3% sales tax on medical devices. This little valve here just costs Shasta Regional, and thus everybody who gets one, 2.3%. But President Obama said he'd never raise a tax on anybody. Well, every device, crutches, potty seats, home beds, walkers, has this new tax. At least the manufacturers have it. Now they have a choice to either eat it out of their profit margin, which may be 5–10%, or pass it on. It's 2,300 pages of legislation that has already passed 20,000 pages of rules. Most of that legislation is Madam Secretary shall, and then it gives her great powers to unilaterally decide how to manage huge parts of the American economy. And there's that 16,000 plus IRS agents to figure out how to get the household income from every family to figure out what they're entitled to pay for their insurance. All right, the law is, again, I'm going to not get too caught up in all of this, but it's basically a finance law: expenditures, taxes, insurance. It's all about regulations and resource allocation, and it defines three mechanisms of delivering health care. Now, there's not one thing in that bill that creates a new medical student or a nursing student in this country that I'm aware of. There's nothing about creating new providers for all these new people that are going to be enlisted. There may be something hidden away, but that really, they weren't about, it was really about finance, expenditures, and taxes, and then the insurance companies being basically bought off into the whole system. But here's the important part, which will end the evening. I'm not ending yet. Recognize there's what I call a three-legged stool of care delivery systems. So Medicare, which is our old one. Now remember, that was robbed of $700 billion to pay for this stuff. Medicaid, which here we call Medi-Cal, which is for low-income people. Medicare is for those over 65. And then this new entity, which is just so warm and fuzzy, it's called Accountable Care Organizations. Think HMOs revisited, rebirthed with a little different model. But these are going to be, accountable care organizations are going to be large groups of doctors and hospitals and providers who are highly incentivized to save money and create efficient care, which, if that were all comes to pass, would be a wonderful thing. There's no question efficiency could and should be part of our healthcare systems. But we didn't live through HMOs, and I was an HMO provider. No HMO owns it. Well, I shouldn't say no, but most HMOs just contracted for high-level care like a cardiac surgeon. And we just worked off contracts. Okay, but to define what an accountable care organization during the Bush administration, 10 clinics, which were excellent vertically integrated clinics, the University of Michigan being one, and Geisinger and several others, worked with the government to create a model and all the legislation that would incentivize them correctly. And they then created what they thought would work, passed that back to Congress. Congress wrote the law. Now a Democratic Congress wrote the law that we all call Obamacare. And when the 10 clinics that had designed it saw what came out, all withdrew from the program in May of 2011. They said, we can't do this. What came out of the sausage factory was totally not what they had put in. The American Medical Group Association, which represents Mayo Clinic, Cleveland Clinic, and others, in May, also 93% of their members will not participate. That's a big hunk of healthcare providers that are standing on the sideline waiting to see what's happened. Now, that was as of May 2011. Here's just some of the names. This is the letter they sent May 12th to Donald Burswick, the administrator, and it says, I'm sorry, but we can't continue down this path. Now, there may have been some adjustments, but remember I said confusion will be part of what brings this to its knees. Here's just some of this. This is Modern Healthcare, January 2013, this year. Stomachs churned across the country last week after HH Secretary Kathleen Sebelius unleashed a massive publicity push to notify millions of uninsured Americans that they would soon qualify for affordable, quality health care coverage. End of quote. That was Kathleen Sebelius' thing. Basically, this is the hospital industry saying, nobody knows how this is going to happen in any state, but they're out there pushing this already to get people to sign up. So here you have delays on federal details leave states ill-prepared to open exchanges. That was only 2 months ago. Here's one locally. Prepare for healthcare changes. Exchanges for good or ill arrive this fall. Yes, they do. And California wanted to be number one, so we're out the gate. We've got one. I'll show you all about that. Medicaid costs concern states. Well, Medicaid is where, remember all those 40 million people they talked about not being insured. That's where many of them, if they're low income, will be dumped into the Medicaid or what we call Medi-Cal. There's a problem, though, because there's no Medi-Cal providers anymore. It's always been part of charity. I've done it since the day I started after my residency. And it's always just been charity because the rates were horrible for a chest surgeon or a cardiac surgeon. But we did it because patients needed it, and this is what they had. But as you drive it lower or you expand the piece, how much part of my time it takes. Remember, I can only do one operation at a time. I don't have 5 people working in back rooms. You can't afford to participate in something that's so bad. Now, but here's how a politician at the state level looks at Medicaid money, because it's federal money. In this bill, they seduce the states into participating in this program by throwing free federal money at them. You don't have to pay for anything, states. We'll take care of it the first 2 years. Remember the 100,000 cops in the Clinton industry thing where they would hire all these 100,000 cops, but they'd only pay for them for the first 3 or 4 years. And then the states and cities had to say, well, what do we do? How do we continue this? Well, here is a Perez. This paragraph doesn't have his first name in it, but he is a member of our Democratic legislature. Perez, a Los Angeles Democrat, said the cost of covering the additional recipients is still unknown. See, he doesn't know what it's going to cost the state to cover them. It's important. He already says, I don't know, but would be paid for by the federal government as part of the health overhaul. And here's his quote. This legislation is 100% covered by the federal government for the first 3 years, unquote, he said at a news conference. He is elated. We're getting free money from the feds. Now, he, an elected official, apparently doesn't realize that California actually sends more money to Washington every year than it gets. But he doesn't seem to care. But it's free money for the first 2 years. They're very short-sighted thinking. So we now have an entity called Covered California. That's our insurance exchange in California. They're up and they're running. They have a CEO. They have an office. They've got a staff. And they also have a $680 million 2-year grant from your federal government. Now, that's one state exchange, and it's 0.7 almost billion dollars for 2 years to just set up to do what? That's the exchange. Remember, that's not a doctor, that's not a nurse, that's not a bunch of medicine, that's not a pharmacist, that's not wheelchairs or supplies or buses to take sick to back and forth to doctors. It is to create a web portal where consumers can do comparison, apply federal tax credit towards the cost. It's a website. They're going to review and certify quality health plans. They're going to create a multicultural, multi-language marketing and education and outreach program. And they're going to network with community-based assisters to guide individuals. I guess people who just don't know how to go through the 20-page form that's going to be used to fill out these exchanges. Multi-language call center to help enrollees, And, oh, this is important, administration office to support efficiencies in the organizations and hire 700 people by 2013. So there is $0.7 billion being spent, and there isn't one piece of that that's going to deliver a item of healthcare, except to have an organization and a website and all the infrastructure. So when the president talks about investing in the infrastructure in America, there's a bunch of infrastructure. Now, this entire new payment structure at these exchanges, which is really they've coerced the insurance companies into coming in and offering products. There's going to be 4 levels to these products. It's interesting. The 4 levels, you're going to be able to buy 4 classes of insurance. They're called platinum, gold, silver, and bronze. Talk about class structure, but that's it, and that's in every state. They just picked those 4 precious metals, I guess, out of that. Well, some are precious, some aren't. And you're going to depend upon how you're choosing to buy, and there's all sorts of rules on which those are going to cover, and they're all going to be, every insurance company has to offer plans in those 4 classes. But here's the interesting thing. They're going to decide what it costs you and you and you based on your household income and what you're going to make on your job, and then they apply a formula, and then they already know that if you're 55, that it's going to cost for the gold plan, somebody's going to have to pay, and I'm making the number up here. I'll show you my sons in a second, but I'll make them a number, $5,000 a year, $6,000 a year. Then they'll decide based on your household income, well, you only have to pay $3,000 of that, and there'll be $2,000 tax credits applied to it. Well, it's interesting, tax credits. I always thought tax credits were when you paid a tax that they actually dropped your tax bill. That's what they always meant to me. Not anymore. Quote, the tax credits will be available to all people who are eligible for them, whether they file taxes or not. That's a quote. That's right out of their literature. So the tax credits are nothing more than federal money flowing to the insurance companies under your name. And they're going to decide if the cost of the insurance is $5,000 a year and you have to pay $3,000, they're going to make sure $2,000 of federal money flows off to the company that you pay for. So it's a direct subsidy to the insurance companies of something they're calling your tax credits. But you may be in a position where you don't pay taxes in a year. Doesn't matter. Your tax credits keep flowing, even though you're not paying for them. The tax credits will be paid directly to your private health plan by Covered California. They're going to decide how much it costs you. They're going to decide what's in it. They're going to decide how much you have to pay for it, but it is your plan, according to them. There's more tax credit magic. Starting in 2014, this is for businesses now to encourage businesses to insure people. They'll have more tax credits. They've got a big pile of them somewhere. I don't know where they come from. But the maximum tax credit increases to 50% of whatever that business is supposed to be subsidized to, and 35% for nonprofits. Well, nonprofits, by definition, don't pay taxes, but they're getting 35% of their health care bill underwritten by this pile of tax credits, which are remarkable because they only exist if people have paid taxes, I thought. So this is how government works these days. I'm going to jump through here in the interest of time. This is this comes right off a government website. I didn't make anything up. They show this downtown cafe model with 40 part-time employees and shows what his health care insurance bill might be, $240,000 a year. But he might get this credit for 50% of $40,000. So he'd have to figure out. But the truth is it's going to be far cheaper for him to just give each of his employees $2,000 and say, you go out and buy your thing. And pay the penalty, by the way. So this whole thing about you can keep your health insurance, no. The incentives are structured to push everybody onto these exchanges. And then it gets really complex, the free rider provision. This is what happens if you choose not to buy any insurance. These are the penalties. It gets very complex. This has to do with the business and there's all these clauses. It gets complex to figure out if you're subject to this penalty or not. But here's the interesting thing about it. The penalties are small. And that is the key I'm going to tie this up with at the end. There's the Stanford University professor who says, you will find out if this is really serious when you see if the penalties are large or small. Because if the penalties are small, there'll be no incentives for the young, healthy people to go out and get on the programs. Because they can always buy this thing and pay the penalty for what's called a free rider. And we'll jump by that. But that's just so complex now, and for the average person to fill this out, and then they have to come back and figure out what your household income is. So if your son tries to get a summer job for 3 months, they're going to have to know, to find out if he has to go buy insurance, they have to know your employer's phone number, the parents, employer number, and your taxable income for the year, and roll it together, who you live with and what the household income is, which is a little different than a family. Okay, let's just jump to another subject. Okay, the government's got this all confused, and man, they're going to have an exchange, but it's going to cost $700 million to work it, and there's going to be a lot of rules and funny things. Let's just step back and say, well, how good is the government at really knowing about the moving parts of a complex environment? One important part of the parts to me is the providers, the surgeons, the physicians. How well do they know what's going on? Because they're doing a lot of healthcare planning and manpower planning. So should be of interest to know that the feds are really right on top of exactly what the available resources are to the residents of Reading. So you go to, and you can do this, the official government website for Medicare, and that's actually, I think it's called Physician Compare Medicare. You can Google it. It's really easy to get to. And it's called Physician Compare. And then it says Physician Compare is information about Medicare enrolled physicians. So this is where you go, and then you can do a search. So you put in the zip code. Here's 96001. You can pick a radius, and then you can come down here to various specialties. Well, I said, well, let's go see what the government knows about the number of heart surgeons in Redding, California, or within 15 miles here. Anybody know the number? 2. Me and Ed Potmeyer. That's it. In fact, north of California, from Sacramento forward, there's 4. The entire state, largest state in the country in population. And if you draw a line at Sacramento, there's only 4 people doing heart surgery and working with cardiologists and for emergency care in the entire state. 4 people. I know them. I know who they are. We have our phone numbers. We talk to each other. Your federal government, you put this in. You say, okay, let's run them. You hit enter. Look this very carefully. Viewing 1 to 10 of 21 surgery physicians within 15 miles of 96001 that practice heart surgery. The federal government official listing shows 21 heart surgeons in your town. 15 miles. They didn't even get to Red Bluff. There's probably another 30 down there for all I know. The point is, this is the official Medicare site of every registered physician in the country. One I picked up is Robert Phillips. He's the guy that left town in 2008, which how I got asked to come up here in early 2009 and look for the job. He hasn't been here since 2008. But he's got an address, he's got a phone number, according to the government. So when they're sitting back doing a manpower need, they must see this concentration of all this excellence and care right in Reading. Not true. Okay, so that's heart surgery. Well, that's a little bizarre field. Let's go down to just general practice, primary care, general practice, and family medicine physicians within 15 miles of Reading. 467. Anybody believe that? You laugh. But the point is the government does. The people making the plans, yeah, there's more attorneys than that. But the point is, somewhere in the federal government, if they go to do this search to figure out what's the manpower distribution and the needs in a place like rural Reading, what the heck? There's 460 primary care. Well, how about the mothers and grandmothers here that are always looking for pediatricians? According to your government, there's 194 pediatrics and adolescent specialists within 15 miles of Reading. Anybody buy that? Okay, but your government does. And they're trying to put themselves in charge of managing, remember that whole complex thing? So if you don't have good data or good numbers about manpower usage, and I just pick physicians, I don't know how many millions of nurses they think we have here, but we don't have very many. So anyway, moving on, my son, I went to there. There's also a place where you can shop for your new health care insurance under Compare California and put in some numbers. Am I going too long, Mary? Is this okay? All right. So I put my son in. Now, my son is a 28-year-old, unmarried, absolutely healthy guy. He road crew for Cornell University, buffed out guy. And he's a brand new lawyer making $43,000 he's been out of law school 3 years and working hard in Southern California as a sports agent lawyer, if anybody needs a young lawyer. But his premiums at the middle level there are going to be $4,069 a year. And because he makes too much, he doesn't get any subsidy. See, if you're at $43,000 as a single person, you're not entitled to any of those tax credits. Now, he pays a lot of taxes, but he has no credits. So he's going to be $340 per month. Okay, now he's a healthy Simplest guy you'd ever want to cover. Remember now, what's going to happen? Obamacare was about saving people money. What does he pay today? Because I know. I help him with this. This is how you get to his number. I won't. He also, by the way, has a manual out-of-pocket cost of $6,400 in addition to his $4,000 of premium. So the federal government's saying, we're going to cover him, but he's going to have to pay $10,000 a year of his $43,000 salary before he gets fully covered. What does he pay now? He has a Blue Shield Saver $6,000 policy, which all he wants to do is cover for catastrophic accident or in a hospital, which at 28 and being healthy, that's what I'd want. He wants PPO coverage because he wants to control where he goes and when. He has zero copay, and after he hits his deductible of $6,000, that sounds like the federal one, he has no charges, just like the federal government. But he pays $139 a month. So because of Obamacare, if this policy goes away, this same company can offer a much more expensive policy, and my sons per monthly cost are going to go from $139 to $340. It's a 156% increase. His cost goes from $1,668 a year to $4,272. Now, if his penalty, if he just does nothing, and the day he comes into the hospital, he signs up for insurance, is only $450. Do you see the incentives here? For the young, healthy people, the government needs them to overpay for their insurance to fund all this. So they've created a legal web to push and trap them. These penalties will rise year after year. But the Stanford professor tells you if these penalties are kept artificially low, they're planning for it to fail. Because financially it will, because these are the people that the insurance companies make their money on. So back to that's just my world of my own family, but yours would be the same, and the websites are all available to you. The cost estimates, remember that that $800 billion really became $929 billion of Pelosi by the time people did begin to read it. But now they're talking about these huge numbers of the 10-year cost. That's just, as it goes by, it gets bigger and bigger and bigger. The estimates originally on the cost of Medicare were totally off by a factor of 10-fold wrong. Here's the interesting thing, but all insurance is changing. The exchanges don't exist. The computer systems for millions just in the state, they haven't even designed it. It's going to come up. Everybody's going to have to get on it online. I'm sure the people living out in the hinterlands of Redding's homeless are going to, how are they going to get on this insurance program? Are they still going to show up at the emergency rooms? I think that's where they'll be. Policy details will be affected by the political regulation as to what's forced to be covered. Remember, affordable housing. And 40 million Americans will probably exit their employable health care plans to these exchanges, which are just starting. All right, now here's the thing I'm going to probably close at the end. There's going to be a horrible physician shortage. It's been predicted for a long time. I can tell you it's that. The AMA news, in a decade, 91,000 physicians will not be here. Now, the legislation does contain extending nurse practitioners and PAs and their scope of practice. That said, the high-tech medicine, when I pick up a scalpel and open your breastbone, will never be done by someone except someone who's taken an 8-year residency plus a lot of years of training to do cardiac surgery. Or when Ben Carson speaks about what it takes to become a polished neurosurgeon, he's a pediatric neurosurgeon, you're not going to just pass a law and make nurse practitioner a neurosurgeon. This takes decades to really acquire skill sets. This is the Harvard Medical School alumni front page about the disenchantment and disenfranchisement physicians feel in this whole process. Mamas, don't let your babies grow up to be doctors. So you can tell what the rest of that's the Harvard Medical School alumni journal. To be quick, Medicare payment reduction over 12 years to me as a cardiac surgeon. Remember, when I operate on a Medicare patient, the government decides what it's worth and sends a check for 80% of that to my office. It's price fixed. I don't get to bid. I can bill whatever I want. But the government is price fixed physicians for over 20 years. It's one of the only industries in America that has price fixing. If you correct for inflation between 1996 and 2008, that's a 12-year span, the check value that I get for doing coronary bypass or this valve I put in our good friend Ed Roberts, that saved his life, What we get paid to put this in today is 72% of what we were paid in 1996. So we're at less, 72% less. We're operating this, so what we get today, make sure you understand this. We have been cut 72% by what this is worth to the federal government. So we now, the reimbursement for an aortic valve replacement in 2008 here, and it's gone down since, is only 28% of what it used to be. Medi-Cal, that's the Medicare reduction. This is why physicians are finding it hard to continue to see Medicare patients. Medi-Cal is broken and the rates are being cut. I moved 2 blocks in Long Beach after being there for 22 years and taking care of the children at our children's hospital who are mostly Medi-Cal. As soon as Medi-Cal found out I moved, they canceled my presence there. It had made me reapply. It was 128 pages, and 6 months later, I got my next check. So I was expected to operate on children for 6 months free by the state of California because I had moved, and they had a security program in there because maybe the new address was fake. They didn't bother to come out and check us out, but that's a fact. Medi-Cal is despised by most physicians. It's tolerated because on the other end of it are people with eyes and hearts that you'd like to take care of. Remember the additional plan, 27% pay cut, that's still out there. Okay, the high-end specialties have long training specialties are challenged. These are the cardiac and neurosurgery. It's a minimum of 8 years after medical school to even begin to start a career in these fields. In the United States, as we speak today, there's 106 residencies for cardiac surgery. Only 82 of them last year had applicants, with the baby boomer coming down the road. So you have young people are saying, why am I going to spend 8 years of residency? And my last year, I did over 200 heart surgeries, was on call every day, every night for 2 years. And I made, at the end of my residency, 8 years after medical school, that was my only job, $16,500. Residency is arduous, underpaid, but it's about training and a commitment to what you do. So no one is taking a long residency if indeed they're going to end up working for the government. Medi-Cal in this state, they're anticipating a 38% increase in enrollment, but if you go look for local physician access, there are no doctors in this town that are taking new Medi-Cal patients. None. Except in Anderson and Cottonwood, there's 2 groups. That was it. I had my office call around. There's no one who can afford another Medi-Cal patient in their practices. Pediatrics, OB, you name it. Well, I'm sorry, primary care. We didn't test OB. Medicare is only available as new patients with the supplement program. And it's a wonder if we'll ever have the ACOs, the Accountable Care Organizations in this area because of size, although I do think Dignity and Mercy are trying. So those are the 3 libs. That's closed and there's no providers. That can only get in with a supplement, and it's very hard to find doctors taking Medicare folks. And this doesn't exist. There you go. Those are the 3 arms of this big plan, and they're all pretty shaky. So the perfect storm is declining training programs, physician disenchantment, retirement, increasing demand, meaning that we now have more patients that need the orthopedic surgeon, the neurosurgeon, the cardiac surgeon, and then increasing technology demand, and then declining practice in our capital. Because the excess income has been totally wrung out of a practice, you can't hire any new people. There are no jobs. And then finally, the ICD-10 chaos. I think I have some funny examples of that to keep you entertained because you need to laugh. Here's a time to laugh. In the middle of all this, the government, in cooperation with the United Nations, believe it or not, and the World Health Organization, has decided to totally revamp all the computer codes by which we do our documentation and billing. So they've decided, they turned this over to bureaucrats actually within the World Health Organization, and they decided to create a coding system so big and so complex because they wanted to track everything. So we went from about, I think, 14,000 codes to now about 89,000 codes. And you're supposed to know them, and you have to figure out how to document in your emergency room or in your hospital. But here's 2. Read these. These are 2 isolated codes. Here's a code for a pedestrian on roller skates injured in a collision with a 2- or a 3-wheeled motor vehicle in a traffic accident. Now, you've got to be on roller skates to get this code. So when you go, so you got a pedestrian that's been injured in your ER. Was he on a roller skate or was that a skateboard? And then you got to know the number of wheels that ran over him. It could have now if you're a roller skater with a 4-wheel car hitting you, that's a totally different code. Now, you got to think of the mind that really wants to track these things, but they exist. And they're now running healthcare, and they're feeding this into that same federal government plan. as to how to do things. Here's the best one: drowning and submersion due to falling or jumping from burning water skis. Initial encounter. I'm not that good a jokester. I did not make this up. It lifted it right out of the books due to my billing and code person, who's a lovely local girl. Now, it's interesting. You can drown, but that's only the initial encounter, as if maybe you can drown and come back for a second visit. I don't know. Now, the Supreme Court has said access to a waiting list is not health care. Unfortunately, it's the Canadian Supreme Court, not ours. But they're true. That's correct. And that's really what's going on here, is that all this planning and intricate work and the committees and this and that is just bureaucracy. But if there's no providers, if there's no new nurse practitioners created, if there's no hospitals built, or hospital beds, or technology purchased, or there aren't people entering the cardiology and cardiac surgery residencies, or neurology, or orthopedics, then what are you going to provide? Who's going to do it? And here's the key. Alain Einthoven, who I'm sorry to cut his name off there, has been in the healthcare, economics, and the academics and finance for a long time. I've gone to meetings for well over 20 years where he's presented. He's a pretty sensible guy. He's in the business school, professor emeritus now. And he actually participated with the Clinton White House with Hillary Care. And this time around was asked to consult, but he said it was just crazy. He said he showed up and no one even asked his opinion. Now, he knows more about this subject than anybody. He created the whole era of managed competition, which we call HMOs and PPOs. That came out of Alain's mind. And here's his statement in 2011. I fear that the legislation they have passed is set up in such a way as to make the private market fail. And he's correct, because those penalties are so low that the people paying the insurance premium dollars, remember my son who's willing to pay $1,600 a year right now, but he may not want to pay $4,000 just because the government says so. If they abandon the marketplace, this enormous hole is going to open up, and the only way to pay for the more expensive policies is more of those tax credits printed over there by the Fed, I guess. I mean, this pile of tax credit has to keep the insurance industry going, I guess. Remember this statement? You never want a good crisis to go to waste. That was Rahm Emanuel, now running, speaking honestly, actually, just like Nancy Pelosi couldn't help herself speaking honestly. I'm concerned that what we're going to have is a sudden crisis with no providers, no payment for providers, a system in default, and basically a single payer equals total control, which gets back to where this whole debate started in the progressive world. They really wanted to nationalize healthcare. I don't know this is their plan, but when you have someone as learned in this field as Alain Einthoven saying, aha, when they made those penalties only $95 or 1% of your income, whichever's larger, that was his key. He said, no, they're not serious about forcing everybody. The mandate has to have a huge penalty if you're going to gather all these dollars from these young working 28-year-old lawyers like my son. So I think that almost the conclusion of my talk. It's a big, long journey. It gets complex. I hope it hasn't bored you. But everything in that complex screen is going to affect your future one way or the other. We're all in this together. I'm a provider. I'm also a Medicare age. I know none of you thought that, but it's true. And I have 5 grandchildren. I have a responsibility to my progeny and my family, just as you do. I want to see a country that's strong. In fact, there's a wonderful letter by a 101st Airborne lieutenant who died in D-Day night, but he wrote a letter to his wife sitting in his C-47 before the takeoff. I didn't actually bring it tonight, but I'll mention it because his name was Thomas Meehan. You've never heard of him. But in the 101st Airborne, this letter to his wife is very good because he writes this letter as they're waiting for takeoff and then hands it to the chaplain who sees that it gets delivered. His entire plane was shot out of the air. But he writes to his wife, he says, if we're ever so fortunate to have a son, I want him to grow into America that's strong as hell and as kind as Christ. And he says, I'm about to take the finest group of men into battle in Normandy and will give those bastards hell. That's his quote. And he says, but I only long to return to you and hold you in my arms, Tom. In that short 2 paragraphs, he summarized what a young lieutenant about to go into battle, what he really saw as reason to be there because he felt the Germans were particularly an atrocity on the world experience. He wasn't afraid to die. He loved his men that he worked with. He was very much part of that team. But he was doing it for his son. And that is really what we are our progeny's forefathers. And I think the American people need to start thinking that way. What kind of country are we going to leave to our progeny? I choose to be informed and responsible. And I think it begins with knowledge of just what's really going forward. And I hope this talk tonight and the meeting has helped to do that. Thank you very much.